So my name is Richmond Akatue. I've been a doctor for 17 years. I went to medical school not because I knew that's exactly what I wanted, but I had very good people in my life who mentored me by watching me as a young person, my demeanor and how I treat people, and thought it would be the right profession for me, and I don't regret it. I currently practice here at Meharry Medical College Internal Medicine Department as one of the primary care doctors. I also train the young doctors who are in their residencies at the moment as the program director. So a primary care doctor is, in a nutshell, is one individual who actually serves as the central repository, you can call it, or central figure in helping any patient either with chronic conditions or if they are lucky enough to be totally healthy, in making sure that you remain healthy. The primary care doctor works with other physicians. If you have chronic conditions such as epilepsy, work with a neurologist, would work with the OB-GYN for females, would work with a cardiologist or any other specialty, depending on the chronic conditions that the patient comes with. We all do need primary care doctors, and why every individual needs to have a primary care doctor is that you need one central individual who will help you manage either chronic conditions that you might have, or if you don't have any chronic conditions, who would help you remain healthy. There are certain milestones, certain conditions that come with age that the normal human being will not know that. But working with a primary care doctor, they serve as your coach in telling you when this is due, when that is due, and it's up to you to help in getting that done to ensure that you're healthy. For example, if you have epilepsy and you do have diabetes, your primary care doctor needs to know that if your sugar is not well controlled, it could have something to do with your epilepsy. So we'll talk to your neurologist, and together your neurologist will now understand that your sugar is not controlled, probably because your medications are too strong and you're probably not staying awake to take your medicines. But without the two, you would probably get one side, a neurologist taking care of you, your seizures are under control, but your blood sugars are going out of range. Or you have a primary care doctor, you don't have a neurologist, and he just concentrates on your blood sugars, neglecting the fact that you're actually taking too much medicine and you're not able to function. To find a primary care doctor as a woman with epilepsy, I would suggest you talk to your family. I would suggest you talk to your members of your church, people who you're intimately familiar with and trust their judgment. You could talk with your neurologist, who you've known hopefully for a number of years. Either way, they are more inclined to help you get the right doctor for you. Your family members would have had good experiences with some doctors, or would have heard from other people why those doctors are the right doctors for you to go to. So I strongly suggest that you talk to your family members and people who you're very familiar with, and your neurologist, because it's very easy for each one of us to look at somebody who looks good and just assume they must be good at what they do. They wear the white coat and they look elegant, but that elegance does not really help you. It's what they bring to you, what help they provide for you, what time they have for you, how well they know you or are inclined or have the desire to know you. That's what drives your health. So their ratings online could be true, but could also be tilted because of exactly the same reasons that I just gave. So it's important to get to know them once you decide who doctor to go to. Once you get to see them, ask questions. Let them know where you are in your state of health and how they can move you to the next level of health. That is the critical part of having a doctor. It's not just a relationship you have just to say hi and bye, but it's something that really should be beneficial, first of all, to the patient. That's you. I strongly discourage patients going to walk-in clinics unless you cannot help it. Give your primary care doctors every opportunity to see you and to record what's happened to you and to manage you with the rest of your medical history in context. The walk-in clinics, they have so many names now that are attached to pharmacies and all other places or standalone. They are readily available, but it's not the best for patients, especially patients with epilepsy who have a chronic condition. Because there are certain treatments for colds, for just the very basic conditions that we get that cause us to run to a doctor or the walk-in clinics. But the treatment can be unfair or have a detrimental effect on a patient with epilepsy, especially women. So it will be disingenuous of me to recommend that kind of fast care. I liken the walk-in clinics that are in the shopping malls and the pharmacies to feeding your family on just fast foods. You could call it very healthy fast food, but it's still fast food. The care and the love that you place in preparing food for your family is missing when you go to places like that. If you have no other way, then yes, get the help you need and get it quickly. But don't forget to let your primary care doctor know what has just happened. Give them a call, let them know you have a cold, you have this, you have a sprained ankle or something. If they say they cannot see you within the shortest possible time, and you tell them, then I will want to go to a walk-in clinic. Let them know that. And after you've been there, let them know what care was provided as soon as possible. Remember, your primary care doctor has the best of intentions for you since you've developed that relationship with them. Getting your primary care doctor, as a patient, getting your primary care doctor, your OBGYN, and your neurologist to communicate is exceedingly important, and I cannot emphasize that enough. Again, each patient needs to remember that they are the focal point where all these other factors, all these other providers come to do their work. And if there is no communication, the left doesn't know what the right is doing, there's a potential for very bad outcomes. The most easily, the most recognizable problem could be drug-drug interactions. A medication that is being provided by the neurologist, most of them go through the liver. The medication that you take for common colds and all these other things, a few of them go through the liver. Some of them go through to the kidneys. But if two medications are working in the same location, there is bound to be some effect. And sometimes the effect is negligible, but most times the effect could be in a few times, the effect could be very dangerous for the patient. So all the doctors involved in your care, especially the OB/GYN for women, that is very essential to have one. As an epileptic neurologist, it's very essential to your care. And as a human being, an adult individual, the primary care doctor is essential to your care. But most importantly, they have to be in sync to make sure that they are moving your health forward, not the other way around. Again, one more important thing for every woman, especially with epilepsy, but every woman of childbearing age should be on folate. There are so many benefits of being on folate. Neural tube defects, which is a defect that can happen to a child if the mother, who is expecting mother, is not on folate and happens to have low folate, could have very detrimental and very expensive effects on the child. The child could be born with open tubes of the spine, and it can happen at various points of the spinal column. And it can be very difficult for the family, from joy to a very serious health problem to deal with in the child, in the newborn child. There are also effects of folate that we know to have beneficial effects on the heart for women, for anybody, but even more for women. There is some talk about the cancer benefits of folate. So I strongly recommend every woman to be on folate. Secondly, most of the food we eat, partly because of the preparation, but also because of the high content of the meats and the fats. The veggies are very little. And so one of our very good folate source is not there on the table. So I wouldn't trust relying on your meals only to provide the folate. So as a young woman living with epilepsy and growing into adulthood, it's important that you remember that the care for a child or people who are considered adolescents and children and adolescents is different from an adult. So growing up, it comes to a point where you have the young woman with epilepsy has to transition from the pediatrician whom you've grown to love, I know, but you're getting to an age where the requirements for your health are beginning to change as your body changes. And you will require an adult doctor. And when that time comes, when you're in conversation with your pediatrician, I'm sure they will tell you, even though they want to keep you in their clinic, they've grown to love you and you've loved them, but there comes a time where your care has to change out of the domain of the pediatrician into that of the primary care doctor. And your pediatrician can help you find a primary care doctor whom they trust and whom they've known and trust to be a good physician for you. So as a young woman with epilepsy, now leaving home and going to college, the challenge, the question is going to come whether or not to have a doctor, your doctor, away in college near you, or you have the one at home. That's a very difficult question to answer, but I can tell you this. Having a chronic condition such as epilepsy, despite the management of it, you could meet a trigger, and you never know when. So it's very important to have a physician or a neurologist wherever you are. I would recommend you having them at both locations, having a doctor where you are in college, nearby, or you could decide to use the doctors on campus who are being provided by your institution. But it's also very important to maintain your relationship with your doctor at home. As much as possible, if you could have them communicate once in a while, especially after you visited one or the other, it will add value to your care, because more information is better than less. Not all relationships are always smooth sailing. It could start well, but then you could hit some rocks. If you find yourself in the position where your relationship with your doctor is not working out, as a primary care doctor myself, I would strongly suggest that you have a candid conversation with your doctor. During that conversation, I would like to hear what my patient thinks is the cause of their dissatisfaction. And I would like I'd like to give it a genuine attempt at fixing that relationship and making sure that it works for the patient. However, after genuine attempts from the patient, if my patient realizes they're not getting the best from me, I think it is in their best interest to let the doctor know, let me know, and they would have to find another doctor to accept them. As soon as they get an accepting doctor who desires to take care of them, I would do everything I can to release as much information to those doctors as possible so that they can get better care from that doctor. It's not personal. Getting care from your doctor should not be personal. But at the same time, it should be very important for the patient to know that they have the right to select their doctor and to get the best out of their doctor. I don't believe in any hindrances in providing care to the patient. And I think the patient should have no hindrance in getting the best out of their doctor. Again, let's remember that we are not, quote unquote, choosing the doctor because of his looks or lack thereof. We are choosing the doctor because they're here and they listen to us, and they will listen to us, and they will provide the best care in their expertise. So hopefully we are not writing off doctors because of their looks, and we are not writing in doctors because of their looks. Again, I emphasize, it's about the value that the doctor is bringing to your health.